going to be our assessment comparisons analysis. We're going to be comparing the VB-MAP and ABLS. I'm Ivy.
I'm Daniel.
Brittany.
I'm Abby.
Perfect. Okay, so let's get into it. So a little bit about our client. He is a little over 2.5 years old, and his primary language is Arabic. He was diagnosed with autism as well as mixed receptive expressive language disorder, and he is a level 2 on that autism spectrum disorder. Some of the reasons why they had that referral was he avoids interactions with his siblings, as well as there's a lack of communication and a little less babbling for his age, as well as that severe problem behavior. Some skills that they're kind of noticing are emerging are those cause and effects play, as well as making eye contact while playing. Some of his strengths are fine motor skills, such as that pencil grip and pointing. Oh no. Some family goals, they want him to be able to communicate and play with his siblings, as well as communicate with others, so they can understand him. So some potential assessment options are those VB-MAP and ABLS. So the VB-MAP is that verbal behavior milestones assessment program, which is basically going to focus on that language and social skills. So this indicates that they are trying to become a little bit more independent and kind of focuses on that. The ABLS is going to focus more on that language, self-help skills, those academic skills, as well as like the development for those diagnosed with autism or any other disabilities. These are kind of more personalized goals, as well as like kind of keeping them more individualized.
Then we're going to talk about the VB-MAP versus the ABLE, since we've gotten a little bit more of a gist about both of them. So the age range for the VB-MAP is anyone regardless of their age. The assessment is broken down into 3 levels that compare patients and children at the typical ages between 0 to 48 months. The ABLS is able to be conducted with anyone from birth to age 12. It compares the average developing child's skill with those of the individual being assessed. The skill range within the VB-MAP, there are 170 skills that this assessment targets within the 3 basic developmental levels that show prerequisites or kind of the skills needed for complex language and social behavior. The ABLS contains 544 skills across the 25 sections, which include math, writing, dressing, grooming, overall cooperation amongst the rest of the 25 sections. With measurements relating to the VB-MAP, it's a direct assessment, meaning that the assessor of the assessment is going to be present. The skills are recorded by a professional being present, and they're either observed or tested by that professional. The ABLS is also a direct assessment, and the observations are conducted in a typical or natural environment to gain a better knowledge on the performance of that individual.
So a bit more on the VB-MAP and ABLS. So for data collection, the VB-MAP is based on milestones. So those are behaviors that are currently present. That's based on, a neurotypical or normal peers, skill level, typically at that same age. They're scored on like a 0, half, 1 point. And there's also barriers and transitions assessments that can assist with that. For the ABLS, these are broken down into different sections where they can be up to 1 point and broken down into quarters and halves. For trusting, based on validity and reliability, we're focused here on learning new skills with VB-MAP. Barriers and transitions can be unreliable sometimes due to not knowing the full range of skills or having a specific time frame. The ABLS is similar. It can be unreliable due to the evaluator's opinion or options when they are included with scoring.
Simply put, we choose the VB-MAP because it targets social skills and language, which are both primary goals for the family. The client is within the age range of this assessment. The VB-MAP focuses on receptive and expressive communication, and it could alleviate barriers from the client's diagnosis. Eye contact is an emergent skill needed in verbal operant milestone sections. Communication skills can alleviate problem behaviors indicated in the parent interview, and the VB-MAP is available in an Arabic translation.